Hello everyone, I'm Dr. Naren Rao. I'm a consultant psychiatrist. So today I will speak about sleep disturbances in dementia. Sleep is one function that is considerably affected in people who have dementia. General belief is that as people age, they don't have to sleep. While to some extent it is true that the requirement of sleep decreases, but it never so happens that somebody doesn't have to sleep as they age. See, people who have dementia, we frequently encounter several kinds of sleep disturbances. For some, it is difficulty in getting into sleep. For some, it is difficulty in maintaining the sleep. For some, it is even after sleeping and getting up in the morning, it feels that as if they have not slept. So it may be something which we call as delay in the onset of the sleep, or it may be fragmentation of the sleep, or it may be a non-refreshing sleep. Why sleep is so important in dementia is that sleep disturbances have consequences in the form of further worsening the cognitive decline. Not only in people with dementia, but for anybody, if the sleep is chronically affected, their cognitive functions deteriorate. And in people with dementia who already have deterioration in the sleep, in the cognitive function, further disruption in the sleep worsens that. So that is why it is very important that the sleep disturbances are corrected. The second problem which also happens when people with dementia do not sleep is it also increases the caregiver burden. Because while patients with dementia may not sleep in the night, but later they may catch up sleep during the day, the caregivers will have other things to do, so that they also find it very difficult when their sleep is not good in the night. So it considerably increases the caregiver burden and also considerably increases the emotional burden to the caregiver. So how do we correct the sleep disturbances in dementia, and why does it happen? There may be several reasons why it happens, but one important thing which happens in people with dementia is that the circadian rhythm, that is the day-night switch which happens in every individual, that may be something that is affected in individuals who are having dementia. So their brain may not be able to switch from the daytime functioning to the nighttime functioning. So it may not recognize that the night has come, so it is time to sleep. So it may continue to work like as if it is day. So how do we treat it? So there are several strategies. One important and the beginning tool to do is what we call as a sleep hygiene practice. So do not sleep during the day. Do not use bed for any other purpose. And also have a fixed routine and fixed time to sleep. Physical activity promotes the maintenance of the sleep routine, so it is very important to do a regular physical activity as well. And also it is important to avoid any stimulants that may be contributing to sleep disturbance. So because in many families it is a common practice to have maybe a coffee or a tea late in the evening, which many times disrupts the sleep quality and difficulty in getting into the sleep. In some individuals, when other strategies are not working, they may need some medication, but this has to be used cautiously because some of the medicines used for sleep may have an adverse effect of deteriorating their cognition. Melatonin is one medicine which is safe, but again you will have to consider medications only after consultations with your healthcare provider. So in nutshell, sleep well, sleep tight so that your memory is good. Thank you.